Honourable John Ajaka.
Mr President, my question without notice is to the Minister for Health. Minister, does Shellharbour Hospital currently have the resources to conduct ophthalmology and orthopaedic surgery? If not, how much money will it cost to properly resource Shellharbour Hospital to perform these surgeries? Can you guarantee the average waiting times for the 573 patients currently waiting for these surgeries at Bulli Hospital that they will not increase in waiting period? Minister, can you guarantee the average waiting times for surgery at Shellharbour Hospital will not increase as a result of Bulli Hospital's waiting list being transferred to Shellharbour?
Minister.
I thank the member for his question. It's indeed a very good question. Obviously, the guarantee I can give in general terms about elective surgery waiting lists is that New South Wales public hospitals are performing the best of all jurisdictions. As I've said to people previously, you don't have to, not that I'm sure the member would, but you don't have to take my word for that. That's the opinion of the Australian Medical Association's 2009 report card on public health, where New South Wales is shown to be the leading state in the issue of in the area of elective surgery and in the area of emergency department waiting times, and indeed 4 out of the 7 criteria for determining the excellence of public hospitals. New South Wales is the lead state. The government is committed to further improving waiting times for book patients in hospitals, though, and the most recent waiting list data, which is published on the New South Wales Health website, indicates at the end of December there were 59,996 ready-to-care patients waiting for elective surgery. This figure has remained fairly constant over the last 12 months or so, and I would expect it to continue to remain relatively constant. While managing the total number on the list is indeed important, what is more important is that we treat more patients over a shorter period of time. That is, that the waiting time for their surgery is reduced and that there are in fact more patients able to move through and have their elective surgery procedures. The average waiting time for surgery in New South Wales as at December was 2.2 months. This figure has also remained fairly constant over the last 12 months, and while the opposition continues to focus on raw waiting list numbers, what they fail to acknowledge is the reason why the total ready for care list has grown. Mr President, New South Wales has experienced the following: an ageing population, improved diagnostic testing in relation to cancer requiring surgery, cardiac and neurological disorders, and in case the opposition has forgotten, the population of New South Wales has also increased, and outcomes of our health system have gotten much better in the time of this Labor government. Mr President, every year almost 260,000 major surgical operations are performed in New South Wales public hospitals. Bulli currently performs, thanks to the intro, Bulli currently performs low-risk, primarily day-only elective surgery in a number of specialities, those specified by the Honourable John Ajaka in his question. Late last year, the Parliamentary Secretary for Health, Dr Andrew McDonald, at my request, reviewed the area's plans for consolidation of surgical services from Bulli. Dr McDonald's findings noted that it was clear that elective surgery needs to be consolidated across the Illawarra region and that surgical services could not continue indefinitely at the Bulli Hospital site. After consultation with local doctors, it was agreed that ear, nose and throat day surgery procedures will continue at Bulli Hospital and orthopaedic and ophthalmological surgery will transfer to Shellharbour Hospital.